Welcome to Rehab 101. I'm Sarah Lidstone, a neurologist from the University of Toronto and the co-chair of the FNDS Education Committee.
Hi, my name's Glenn Nielsen. I'm a physiotherapist at St George's University in London.
Welcome to our course. We are very delighted, Glenn and I, to have you join us to our FNDS Rehab 101 course. We've worked very hard, gathered a lot of expert opinions across the world of people who are working with FND patients, doing rehab every day, and we really hope that you enjoy this content.
We put together a list of lectures with foundational skills for rehabilitation for FND. So our main objectives are to provide practical tools for rehabilitation specialists for a range of assessments and treatment planning for people with FND, to share common evidence-based approaches to therapy techniques, illustrates the benefit of using mind-body approaches and incorporating psychologically informed rehabilitation principles, and also to help build confidence so that you enjoy the next time you work with somebody with FND.
So I'll give you a high-level overview and walk you through how we organize the course. So we've decided to put it together in the chronological order of what would follow a typical patient through treatment from assessment all the way to discharge. So Module 1 focuses on our educational approaches, where it's so important to how we communicate the diagnosis to patients, how they look at their symptoms, and then link that into treatment techniques. Module 2 covers the assessment. So this is what the tools are in the history and also framing the condition, examination maneuvers, both in person and virtually, and how this can apply across the different disciplines of rehab. Module 3 then gets into the nitty-gritty of these practical techniques, and we break it down by discipline. So we include physiotherapy, occupational therapy, speech therapy, social work, and specialist nurses. And we also talk about mechanism and how the mechanism can then lead to these different rehab tools people use. Module 4 is about pediatrics, so adapting these different therapy approaches to the young person in terms of the biopsychosocial model. Module 5 is really about integrating these mind-body techniques, so the psychologically informed rehabilitation in real time, how that looks, how that feels, and how this can be actually coming to life in the clinic. And Module 6 is the patient perspective. So we're very fortunate to have some patients with FND who have gone through rehabilitation, and they talk about their experience and what it's like being in recovery.
So throughout the course, we'd like you to keep in mind overarching treatment principles. And important ones are that treatment starts at diagnosis. There's no one-size-fits-all approach to treatment. And triage is necessary to ensure the right person has the right treatment at the right time. Coexisting symptoms and problems can interact with FND, and they also need to be considered as part of a rehab plan. And also, in most parts of the world, resources for people with FND are very limited. But an exciting thing is this is rapidly changing.
The key thing we really want you to walk away with is that FND is definitely treatable and people can get better. So let's learn how to do it together. So join us. Please join our FND Society. We are a young society. It's very multidisciplinary, and we have a lot of educational offerings that cover assessment, diagnosis, and treatment principles in FND.
We hope you enjoy Rehab 101.